Welcome back to the Deep Dive. Today, we're taking a really fascinating look at something that touches almost everyone eventually, hair loss.
It really does.
And it sounds straightforward, but, medically, it's seen as incredibly complex. Not life-threatening, sure, but the reasons behind it are often murky, multi-layered.
And those long-term fixes,
Yeah.
still pretty elusive for a lot of people.
Exactly. So
Yeah.
our goal today isn't finding some magic bullet cure, what doesn't exist.
Right.
Instead, we want to give you the best shortcut, really. Understanding the three core reasons it happens. Identifying which one, or maybe which combination, is affecting you.
That's the crucial part. We've boiled down, well, a ton of research into three main pillars for most common hair loss.
Okay, what are they?
We're looking at first, the hormonal side of things, second, the inflammatory response, and third, nutritional deficit.
Hormonal, inflammatory, nutritional.
Yeah, and the big takeaway up front is that it's rarely just one single thing. It's usually multivariable. You often need to look at all three.
Okay, that makes sense. So where do we start unpacking this? I guess the most well-known one, especially for men, hormones.
Let's start there. Hormones.
Yeah.
And when we talk hair loss and hormones, especially male pattern baldness, the main player is dihydrotestosterone, DHT.
Right, DHT.
Yeah.
That's what causes that classic pattern, the loss at the crown, the receding temples.
But the sides are often fine. That pattern is key.
We know DHT comes from testosterone, right?
Yeah.
There's that enzyme, 5-alpha reductase.
Exactly. But here's where the research throws a bit of a curveball. Most people assume hair loss means high DHT levels.
Yeah, makes sense. More DHT, more hair loss.
But actually, studies show men losing hair don't necessarily have higher DHT in their blood than men who aren't.
Really? So what's going on then?
It's a subtle but critical difference. It's not about having abnormally high levels systemically. It's about a greater genetic sensitivity of the hair follicles themselves to just normal, everyday levels of DHT.
Ah, okay. That is a huge distinction. So it's like the follicles are just overreacting to what's already there.
Precisely. It's not the amount of DHT floating around necessarily, but how sensitive your scalp is to it.
So if the volume of DHT isn't the main issue, what makes the follicles more sensitive? Is there like a metabolic connection?
There often is. Things like changes in your metabolism, maybe how your liver functions, or just your underlying genetics can all play a role.
Okay.
They can lead to maybe proportionally higher DHT compared to your testosterone.
Okay.
And here's a really important point. If your body is already really efficient at converting T to DHT, working on naturally improving your testosterone levels can be good.
But what if someone thinks, I'll just boost my T with, say, anabolics?
Bad idea for hair. You're basically just giving that 5-alpha reductase enzyme way more raw material to work with.
So more T substrate.
Means more DHT conversion.
Yeah.
And that almost always speeds up the shedding if you're sensitive.
Okay, so artificially juicing T is out if you want to keep your hair.
Mm-hmm.
How do we actively dial back that conversion then? What can people actually do to block that enzyme?
Well, there are options. On the natural side, you've got supplements. Things like African pygium, or maybe more commonly known, saw palmetto, Serenoa repens.
Saw palmetto, yeah, I've heard of that.
They work by inhibiting that 5-alpha reductase enzyme. The upside is they tend to avoid the systemic side effects you sometimes get with pharmaceuticals.
Like what kind of side effects?
Things like reduced libido, changes in sexual function, that sort of thing. Naturals are generally gentler.
But the downside is probably they're not as strong.
Generally, yes. They're less potent than the drugs. So a good approach, since the DHT is acting right there on the scalp.
Target the scalp directly.
Exactly. A dual approach is often best. Use the internal supplement, but also use something topically, right on the scalp. That way you get the effect where you need it without hitting the whole system so hard.
Makes sense. Okay, let's pivot to women. The hormonal picture there can be quite different, right? Often tied into other things.
Yeah, for women, hair loss often links up with imbalances in sexual hormones. Think polycystic ovary syndrome, PCOS, or thyroid issues.
And this tends to kick in later.
Often becomes more noticeable after age 30 or 40, yeah. The sources suggest it typically starts showing around 33 to 35.
Is the mechanism still DHT related in women?
It often is, yeah. Even though the pattern might be more diffuse, like overall thinning rather than specific bald spots, the imbalance is frequently high testosterone relative to low estrogen. It disrupts that protective balance.
Is there an ideal ratio? Like how much more estrogen do you need?
The sources point to a healthy protective ratio being about 8 times more estrogen than testosterone, when conditions like PCOS or thyroid problems narrow that gap.
The DHT effect becomes stronger.
Exactly. The relative androgen effect increases.
And does this hormonal disruption then lead to other problems? Does it connect to, say, nutrition?
Absolutely. There's a direct link. Hormonal shifts causing menstrual irregularities, especially really heavy periods.
Ah, I see where this is going.
That frequently leads straight to secondary nutritional problems.
Okay.
Most commonly, iron deficiency, specifically low ferritin.
So one problem directly fuels another. Hormones impacting nutrition.
It proves that multivariable point again. You can't just look at one thing in isolation.
Okay, perfect lead into pillar number 2. Nutritional deficiencies. I feel like this one gets overlooked a lot.
It really does. People think I eat okay, but
Why is hair so incredibly sensitive to nutrient levels? Why does it seem to be the first thing to go when something's even slightly off?
two big reasons. First, it's about resource allocation. Think of it as your body's internal budgeting system. There's a nutrient hierarchy,
Hierarchy, meaning
meaning your body prioritizes brain, heart, essential organs. They get first dibs on nutrients. Hair, it's way down the list. It's basically optional from the body's survival perspective.
wow, okay. Harsh, but makes sense.
So even if your nutrient levels are just suboptimal, maybe still technically in the normal lab range, but not ideal, those resources get pulled away from the hair first.
So your blood work might look fine according to standard ranges, but your hair is already suffering.
Exactly. The second factor is rapid cell division. Hair follicle cells are among the fastest dividing cells in your entire body.
Really. Faster than skin.
Second only to bone marrow cells, the ones making your blood cells. This incredibly fast turnover means hair follicles are huge consumers of nutrients constantly.
So any slight dip in supply hits them hard and fast.
Precisely. They're very metabolically active, very demanding.
Okay, so if nutrition is the cause, what does the hair loss look like? Is it that same male pattern?
No, typically not. Nutritional deficiency hair loss is usually non-patterned. It's global. Affects the whole scalp.
So just overall thinning?
Yeah, you'll notice slower growth first, then just generalized thinning, more shedding all over. Because it's not a distinct pattern, it often gets dismissed or misdiagnosed.
And you see this more now.
It seems to be getting more common, yeah, especially with very restrictive diets becoming popular, like strict veganism or aggressive keto if they're not managed really carefully with supplementation.
Right. So let's get specific. What are the absolute non-negotiable nutrients for hair? Where should people focus their attention, maybe get tested?
Top of the list, iron, and specifically ferritin.
Ferritin, that's the storage form of iron, right?
Exactly. And the level of ferritin is actually more critical for the hair follicle than your circulating iron level.
And what level are we talking?
The sources are very clear on this.
Yeah.
For optimal hair health, your ferritin needs to be consistently above 75 mg/ml.
75. Wow. Because standard lab ranges often have the minimum way lower, like 15 or 20.
Right. And that massive gap explains why so many people can be told their iron is normal, but they're still shedding like crazy because their ferritin is, say, 30. It's not enough for healthy hair cycling.
Okay, ferritin above 75. What else is crucial?
Vitamin D, super important. And remember, vitamin D isn't just a vitamin, it's technically a pro-hormone.
Right, it acts like a hormone.
And it's vital for regulating the immune system. This makes it key for hair loss linked to both nutrition and inflammation, which we'll get to.
Okay, vitamin D. Anything else?
B12 and folic acid, these often go hand in hand with large ferritin, especially if dietary restrictions are involved. They need to be checked together.
What about all those supplements you see everywhere? Biotin, cysteine, silica, the hair, skin, and nails formulas.
Look, those nutrients are important for the physical structure of the hair shaft itself. Biotin, for example. But true, severe deficiencies in those are actually quite rare in most people eating a reasonably varied diet. So taking extra biotin probably won't fix your hair loss if the real underlying problem is, say, ferritin below 75 or a hormonal issue like PCOS.
So they're building blocks, but not usually the root cause of the loss itself.
Exactly. You have to fix the foundational mechanism first, the hormones, the core nutrients, the inflammation. Then maybe those structural supports help.
Okay, that makes sense. Which brings us perfectly to the third pillar, inflammation. How does inflammation physically cause hair loss?
Inflammation directly damages the hair follicles. Think of it as stress at the cellular level right on your scalp.
How would someone know if scalp inflammation is their main issue? Are there visible signs?
Definitely. Look for things like intermittent itching that just keeps coming back. Flakes, dandruff, or maybe even full-blown seborrheic dermatitis.
That oily, sometimes yellowish scaling.
Yeah. If you have any of that itching, flaking, redness, scaling, you've got inflammation. It usually signals an imbalance in the microorganisms on your scalp.
Like bacteria or fungi getting out of control.
Exactly. Or even tiny Demodex mites. They can thrive when the scalp environment is out of balance, often too oily, and trigger an inflammatory response.
We all know stress is bad for hair, right?
hmm
That shedding after a stressful event, telogen effluvium, how does the inflammation tie into that?
Stress is physiological inflammation, essentially. When you're chronically stressed, your cortisol levels stay high.
The stress hormone.
Right. And high cortisol triggers an exaggerated immune response throughout the body. It basically tells your immune system to be on high alert, and that includes the scalp.
So stress leads to inflammation, which leads to shedding.
It's a key pathway. And this is where nutrients like vitamin D and omega-3s become really important again, because they help regulate and calm down that immune overreaction.
Okay, so again, it's not just about avoiding deficiency, but hitting optimal nutrient ranges to actively control inflammation.
Absolutely critical for inflammation. We mentioned ferritin needing to be 70 to 200 milligml. For vitamin D, the optimal range is generally considered 50 to 80 nanograms SML.
50 to 80 for vitamin D.
And another key anti-inflammatory mineral is zinc. You want that ideally between 70 and 120 micrograms DL. Being in these optimal zones helps keep that inflammatory fire damped down.
And what about dietary inflammation? There's a lot of talk about the omega-3 to omega-6 ratio.
Huge factor. This affects all systemic inflammation, scalp included. The problem is most modern diets are way off balance.
Too much omega-6.
Way too much.
Yeah.
It's everywhere in processed foods, restaurant foods, and especially in common vegetable oils.
Uh-huh.
Corn oil, soybean oil, sunflower, canola.
The ones used in almost everything.
Pretty much. This overload of omega-6 creates a constant, low-grade, pro-inflammatory state in the body. And your scalp feels that too.
So what's the fix? Just cut out those oils.
That's a huge part of it, yes. Drastically reduce your intake of high omega-6 sources. But you also need to actively increase your omega-3 intake to compensate and rebalance the ratio.
Which omega-3s are best?
Specifically the EPA and DHA types. You get those mainly from fatty fish like salmon, mackerel, sardines, or from algae supplements if you're vegetarian or vegan.
So less omega-6, more omega-3, EPEG. That helps cool down inflammation body-wide.
That's the goal. It benefits overall health tremendously, and your hair follicles will thank you too.
This is incredibly helpful. We've mapped out the hormonal puzzle, especially DHT sensitivity.
The critical nutritional needs like that ferritin rule.
And the damage from inflammation, including that omega-6 issue. So wrapping up, what's the core message people should take away?
The bottom line is, stop just treating the symptom, which is the shedding. You have to identify and resolve the base mechanism first. Is it primarily hormonal for you? Nutritional, inflammatory, or a mix?
Targeted treatment, not just a generic hair vitamin.
Exactly. Find the root cause.
And patience is key, right? People want results yesterday. What's realistic?
You absolutely need patience. Remember those hair growth cycles, anagen, catagen, telogen, they take weeks, months.
So how long should you stick with the treatment before deciding if it's working?
Give any new approach at least 3 or 4 months, minimum, before you can really judge its effect.
And can these issues be permanently fixed? Or is it ongoing?
It depends. If it's strong genetic DHT sensitivity in men, that might require lifelong management, like continuing to block the enzyme. But other imbalances,
Like PCOS, thyroid, or a simple nutrient fix.
those can often be fully corrected. Once your hormones are balanced or your ferritin is optimal, you might be able to stop continuous supplements. The underlying issue is resolved.
Okay. And quickly, what about things designed purely to stimulate growth, like minoxidil, lasers, PRP?
Those should generally be the last step, not the first.
Fix the foundation first.
Right. Optimize hormones, nutrition, inflammation. Then, if you still need an extra boost, consider stimulants. But be aware, especially with minoxidil, the drug, if you stop using it.
The hair you gained often falls out again, right?
Yeah.
Rebound shedding.
Very common, yes. PRP, platelet-rich plasma, can be good for overall scalp health, but as a pure growth stimulant, the evidence suggests it's maybe less potent on its own than drugs or lasers.
Got it. Fix the cause, be patient, then consider stimulants if needed.
That's the strategy.
This has been incredibly insightful, especially that point about hair cells being the second fastest dividing cells after bone marrow.
It really highlights their nutrient demands. They're like the canary in the coal mine for your internal nutrient status.
So that leads us to our final thought for you, the listener. Consider this. If your hair is so low on your body's priority list that even suboptimal nutrient levels levels that might look normal on a basic lab test but aren't truly ideal get diverted away from it.
What else might be feeling that pinch?
Exactly. What other subtle signs might your body be giving you that indicate your nutrient levels aren't quite optimal? What is your personal nutrient hierarchy prioritizing right now, perhaps over your hair? Something to think about as you look at your own health picture.